Dr. Gifford on how we get cavities.
Getting cavities in your teeth, whether you're a child or an adult, is about three things. It's about frequency, it's about intensity, and it's about duration. And what we're talking about is exposure to sugars. And everything we eat at some point breaks down into sugars. And that's not to make things hopeless. But if we can control frequency, how often we put those sugars on our teeth, intensity, how strong or how great the sugar content is. So sugar content in a piece of broccoli is a lot lower than in a Laffy Taffy, right? And then for duration, how long does that sugar stay on the teeth once it's on there? So how do we control that? If we're going to have a sweet treat, and let's be honest, at some point our kids are going to have sweets, combine it with a meal. So at a time when we're already putting food in our mouth, and limit our treats to those 3 or 4 times a day when we actually eat. Intensity. Try to control the level of sugars that our children are eating. Have things that are not quite so heavily sugared, and have fewer of those things that are heavily sugared. And then duration. After we eat, get a toothbrush in there, clean it out. If we're not home where we have a toothbrush handy, follow up that juice, or that, if they have to have soda, that soda, with a cup of water. Rinse out those teeth, get as much of it as you can off, and then brush as soon as possible.
For more, go to mycoolsmiles.com.